Good Sunday morning, I'm Jaden Jefferson, and welcome to this week's Community Focus. My guest this week is Lucas County Health Commissioner Karim Baroudi to discuss the COVID, flu, norovirus trifecta and how things are looking in our neck of the woods. Take a look.
Kind of give me an idea of what everyone at the health department has been seeing with regard to the flu.
You know what? We're hearing a lot about it today because multiple things are coming all at once. It's the season, where people get together and gather, and it gets cold out. More people are indoor. I think we're seeing some flu activities. It's to be compared with what we've seen in previous years, to be honest with you. We've seen a little uptick, building up during the holiday in December. We've seen a peak of 22 hospitalization the first week of January, and now we started to see that trending down a little bit. But that's to be expected. You are contagious from the first symptoms of the flu. A lot of people will have the flu, and you won't be as severe. So those are the numbers. We always look at hospitalizations, which is severe flu symptoms, and where people will require them to go to the hospital. That's what we keep track of, and we're always watching. We have disease prevention specialists here. They're always watching what's going on with the flu. But again, it makes it every when we came back from the holiday, you ask how was your holiday, and say, well, most of us were sick, and to that extent. It feels like we're seeing an uptick, but if you isolate flu alone, flu is seasonal, and I think we're keeping the trends with previous seasons. We're actually a little below than the 5-year average, which is great news. That means a lot of people got their shots, and they're being protected. They're being careful in gatherings. They're being careful in interactions on the communal level, which is great. Now we see it's a little bit of, we're seeing some other stuff with the flu. We're seeing a little bit of uptick in norovirus as well. Norovirus is a stomach flu. A lot of we call it stomach flu in a lot of times, but to that extent, it's very contagious, highly contagious. And it's fecal oral. So, a lot got to do with, people having diarrhea and, use the bathroom a lot, or even, not washing their hands properly. The difficulty with norovirus is it will stay on inanimate, objects like, doorknobs, elevator buttons, any, chairs, anything that they can stay for up to 72 hours on there. And that's the difficulty with it. We've seen, small norovirus look like because it's never been isolated and tested to make sure it's norovirus. But from the symptoms, from the duration of illness, the diarrhea, the nausea, the fatigue, we've seen it in small institution-like settings, communal settings. It could be an issue in schools and, daycares. That's why we caution that this is highly contagious. It can be transmitted in food. It can be transmitted, again, on objects that are inanimate, like tables and doorknobs and so on and so forth. That's why it's highly recommended that we do a lot of hand washing. It's highly recommended that we do a lot of sanitizing the surfaces. If we're sick, we make sure we stay away from others as much as possible to contain the virus.
One of the things that we're also tracking here is the flu, norovirus, and COVID thing that we have going on, where there are multiple different viruses. So with so many different viruses that we're dealing with, does it really impact the flu that much to have COVID going around as well as norovirus going around?
You know what, public health officials, we're always nervous when we have that multiple virus going on in the community and they are active. And again, for as much as to be expected, but having all those viruses going on at once, it could be a burden on the individuals, on the population we serve, from many perspectives. People are going to miss work and school if they are sick, but not the good thing, but at least the better things with the norovirus, it's very short-lived. It's usually 24, 48 hours, again, of diarrhea, and fatigue and everything else, sometimes vomiting as well. It's short-lived, and if we take the proper precautions, most people, will get over it quick. We have to be careful with little kids because it does cause dehydration quick in little bodies, like little kids and infants. So we have to be extra careful. If we suspect any of those, we urge everybody to see a doctor immediately. Now, at the institution level, if you feel like you've seen an uptick of in a school setting or any institution setting, you've seen more people getting sick or calling off sick because of those symptoms, please contact the health department. We have a lot of resources that we can help them, contain the transmission of that virus.
And I know this is a term that a lot of us haven't heard since the COVID-19 pandemic, but contact tracing. So is that something that people should be doing if they suspect that they've had norovirus or COVID?
Yeah, any time we do have a confirmation of a COVID, norovirus, or flu outbreak, we call them outbreak, or a little uptick in numbers in a certain settings, we do start kind of a contact tracing to make sure we hit everybody that came in contact with that person, everybody that came in contact with with that virus, to make sure we give them the proper guidance to get them through it safely.
And RSV is another concern for kids in particular, because I know you had mentioned that flu was something that we should worry about when it comes to kids, but also RSV. So have we seen any RSV activity in the Lucas County area?
We've seen a little activity, but I don't think anything that should be of a concern right now. We know there's a vaccine for RSV, there's a vaccine for flu, there's a vaccine for COVID. So I think the message, and as you are, relaying that information, I think it's very important to stress the need to get vaccinated, because those are all preventable, or at least it will be of a lesser burden of the disease if we are vaccinated. That's proven.
For sure. And obviously, a lot of the work that goes into this can be difficult because you have schools that are also congregating in a lot of settings. So what advice would you give to environments where kids are going to be forced to be in close contact? So what are some things that schools can do in terms of reducing the spread?
Yeah, I think monitoring is very important, again, to see if there's students or faculty, for that matter, who come down with some of those symptoms. Advise them to stay away from this classroom, advise them to stay away from students, for a little short period of time where they will get through the infection and won't be infectious anymore. But more importantly is if you see an uptick or you suspect anything that's going on a communal level, more than one or two people who are affected by it, contact the health department. Our disease intervention specialists will be able to help you through those infectious disease.
Yes, and vaccination, of course, is key. And so what do you recommend in terms of setting up your vaccination appointments? Because I know I got my flu shot and my COVID shot at the same time. It didn't feel so good. I now regret doing them at the same time, but should people set that up?
No, we appreciate you protecting yourself and protecting others. I think this is important to go into the vaccination and the flu and the COVID season with that mentality. That's, it's for my own protection. I'm protecting everybody else, even individuals who cannot be vaccinated. But as far as an appointment, I think we do have walk-ins. If you don't feel comfortable taking them both at once, I think our team of nurses will accommodate you coming back for another appointment to get your flu shot. But again, it's never late. We recommend that flu shots be taken in October, but now it's better late than never, to be honest with you, because we don't know how that flu virus is going to behave in the population settings. That's why it's always good to take all our precautions.
Yes, and it's definitely better to have just like a one-day pain compared to a week-long pain, because that's
Absolutely.
A different story.
Absolutely.
And obviously, the elderly as well is another group that we have to pay close attention to. How can folks protect their elders as well?
Yeah, in all infectious disease, we have, you got a good point there, elderly, immunocompromised individuals. We want to do a little extra to protect them. Again, wash our hands, sanitize the surfaces that are the environment that they are in. Make sure if we are sick, we don't expose them to any of the stuff we're carrying. I think it's important to be extra precautions, take extra precautions with the elderly, the immunocompromised, the people who are their immune system is under stress for one reason or another.
Well, thank you so much for your time and getting us all up to date on all the viruses that are going around.
No, thank you so much. And anytime, please reach out with any information you want to spread, and we'll be more than happy to help.
That's this week's show. Thanks for watching.